On behalf of our board of directors, our staff, and nearly 2,000 members, I'm pleased to introduce tonight's program. The Visalia Chamber of
Commerce is an extremely active organization with hundreds of
dedicated volunteers who take a dedicated and influential role in making Visalia a unique and truly remarkable community. We recruit and assist businesses and provide training and guidance to help ensure the success of those businesses. We're also working to maintain and improve the quality of life in Visalia by supporting excellence in education and leadership development, good government, and a safe and healthful environment. Each week, Visalia Business focuses on a program or issue that is important to our community and shows how individuals working together can make a difference. I'm glad you've joined us this evening, and I hope you enjoy the program.
Welcome to Visalia Business, brought to you by the Visalia Chamber of Commerce. Tonight we're going to be talking about one of the more controversial happenings lately in Visalia, and that is the announcement and the purchase of the Visalia Community Hospital by Kauai Delta Hospital, Kauai Delta District Hospital. And here tonight with us is Carl Anderson, who is a member of the hospital board, and you're also the treasurer, right. Carl? Mm-hmm. And Lindsay Mann, who is the vice president of, give me your title,
Planning
Lindsay?
and Professional Services. Good to be with you tonight.
Thank you. Thank you very much for being with us. And we wanted to find out a little bit more about the details. There's been a lot in the papers about the purchase, and people are wondering what it's going to mean to the future of healthcare here in Visalia. Carl, was this just a sudden occurrence or thought to purchase the Visalia Community Hospital, or is this something that the district hospital has been considering for some time?
I think the first time we entertained a thought of buying Visalia Community Hospital was like 21, 22 years ago. So it's come up numerous times, and I think this was about the fourth run, actually, that we took at it. As far as it coming up this time, it came up very quickly. It was shortly after the 4th of July that Health Trust, the owner of the hospital, came to us and let us know that it would be on the market, that they were interested in selling it. Didn't fit in with their strategic plan and their strategic operations as far as the whole United States is concerned. And so they asked us if we would be interested in taking a look at purchasing the hospital. They set some very short timelines for us to respond. So when we were asked to whether or not we would be interested in it, we ran through some economic analyses, and we had to respond very, very quickly. So in the long run, we had looked at it several times in the past. This time, it was a very short time frame that we had to respond.
And what was the purchase price?
$9,796,000. No sense. Mm-hmm. The purchase makes sense, but there's...
Yes. Lindsay, one of the words that we've heard in connection with the purchase of the hospital is the word monopoly, and that always raises a concern in some people's mind as to how that's going to affect perhaps the cost of healthcare in the future if just one hospital has a monopoly. Could you respond to that concern?
Yes, I'd be very happy to. First, historically, Kauai Delta Hospital has maintained a price position that has been better than what has been offered by Visalia Community Hospital by its four predecessors in proprietary companies. Currently, the most recent data that we have, for example, from the Office of Statewide Health Planning and Development indicate that where our charges per outpatient visit are currently $172 per visit. At Visalia Community Hospital, they have been at $397 per visit. Let me compare now inpatient costs per visit. They are $1,761 at Quid Alta Hospital, and they are $2,500 at Visalia Community Hospital. So at least if the argument is that competition brings down prices, ours have historically, and for my tenure at the hospital for 13 years, we have maintained a charge position that has been considerably less than Visalia Community Hospital. Now the second point on monopoly creating an opportunity to increase prices, we are now throughout this entire nation going through an evolution in health care towards managed care. And in a managed care environment, third-party payers, insurance companies, as well as the federal government and state government, are indicating what prices they will pay for services. So really, the price equation will become less important in the future, and we have proven very definitively throughout this nation that competition in healthcare does not work. It does not bring prices down. In fact, what happens as competing facilities develop similar programs, similar facilities, and add very expensive technology that goes through a very short obsolescence cycle, we very frequently find that in the past, healthcare prices have gone on a spiral upward. In a managed care environment, hospitals will be dictated what the price for care will be, and they will be encouraged to work or manage their hospitals within the constraints of the prices dictated by third-party payers. So I don't think the fear of prices increasing in Visalia by virtue of this acquisition is an issue at all.
What about the jobs? How many people work at Visalia Community Hospital now?
We have approximately 350 employees at Visalia Community Hospital. Before this Friday passes, they will be offered an opportunity to become employees of Quid Alta Hospital to support our commitment to maintain Visalia Community Hospital as an acute care facility over the next 6 months, during which time we will study the possibility of merging operations, changing operations, perhaps as much at Quid Alta Hospital as at Visalia Community Hospital. We will have an opportunity through very careful study and deliberation with medical staff, employees, members of the community, to study what would make best sense. But we will be hiring the staff of of Visalia Community Hospital. Effective this Friday, we will be offering the opportunities, and then those that wish to, effective September 1, would become Quid Alta employees.
I see.
I should mention in full disclosure that there are only 2 that will not be offered opportunity, and they have been informed of this, the Chief Executive Officer and the Chief Financial Officer, because we have those resources within Quid Alta already, and immediately we gain some of the economies of scale of not having to duplicate the kinds of administrative structure and finance structures that are necessary when you have 2 separate operations.
Okay.
I think it's a point you can also make, Lindsay, is that those 2 positions are health trust employees. They're not local employees, so they belong to the corporation that owned the hospital before.
I see. So you're really retaining all of the local employees.
That's an excellent point. That is accurate, and Health Trust will make decisions with regard to their staff members as to the disposition of their positions.
Well, I'm sure that in your position as the Planning and Professional Services Vice President.
Yes, or Supreme Commander, as we occasionally guess around our house.
We do that today.
I had to get that in there. Thank you. Go ahead.
You're going to have quite a strong role in the study and looking at what is the best use that the hospital might be put to. I know there's just a lot of rumors that are flying about the community that the hospital could become perhaps a convalescent hospital or a special birthing center, or even might be eventually shut down. I know that you haven't had a chance to really study the issue, but do either one of you have any thoughts as to how that the hospital might serve the community in the future?
Could I?
Sure.
Okay, I'd like to maybe can we chat just a little bit about that?
Okay.
There was a lot in what you just said.
Yes.
First of all, one of the things that is in there is a basic question. You mean you bought a hospital and you don't even know what you're going to do with it, right? Isn't that, that would be a logical...
Well, the community hasn't heard yet.
Well, that's right. And wouldn't the community ask, why would you spend $9.8 million on something and you don't even know what you're going to do with it? Logical question to ask. Okay, let's go back why we bought it, all right? Health Trust had the facility on the market. They were going to sell it to somebody. We got to, we had a period there where we could take a look at it, and what we did, this is the treasurer speaking now, treasurer of the hospital speaking. We looked at the economics of Visalia Community Hospital standing alone. We looked at the economics of Quia Delta District Hospital standing alone, and then we looked at the economics of merging the two and optimizing both facilities in an overall concept. And what we saw was that there's an opportunity for some significant cost reductions by operating the two in concert versus the two separately. Okay, the Quia Delta Hospital District is not a profit-making entity. Any positive cash flow that comes in gets either turned around, you do one of three things with it. One, we increase the services we provide, we improve the services we provide, or we lower our charges, lower cost. And so what the board saw was an opportunity for some significant cost reductions and attendant reductions in the cost of health care to the community. So as far as that was concerned, it was a slam dunk to do that. Now, buying that facility also provided us some significant flexibility in how we use the physical plant. And that's what Lindsay's talking about. It may impact how Quia Delta Hospital is affected as much as Visalia Community. That gain is frosting on the cake. That's an added benefit, and that right now is what we're considering, how to get the most out of that. So basically, it was an economic decision where we saw a chance to really lower some of the costs for healthcare in the community. So that's why we bought that, and that's why you would buy something and not know specifically, because it's driven by the economics of it.
But it wouldn't make sense to just close it down. I'm sure that you would have good use of that
absolutely.
facility.
We have no plans to close it down. In fact, I'd like to give prominence to the role that Margaret Foley and Tess Lira, two members of our board of directors, will play in the evaluation of what the opportunities are, as much for Visalia Community as for Quia Delta Hospital. I think one of the strengths of Quia Delta Hospital, acquiring Visalia Community Hospital, as opposed to having one more proprietary company, perhaps based outside of the state once again, is that we do have 5 members that are elected by this community to look at the district's interests. Visalia Community Hospital is within the district's boundaries, and we have 2 members of the board that will help interpret what community needs are in healthcare. They will not do it in a vacuum. I will certainly participate in some of that analysis and supporting the district, but in addition, we will be inviting members of our medical staff, both Visalia Community and Quia Delta Hospital medical staff, to participate in that dialogue, so that what comes out of this process of analysis over a period of 6 months are very well-reasoned decisions that add value to our healthcare complement here in Visalia, and do so in the context of lower costs. The issue of lowering costs while still creating a very excellent healthcare system is not an academic one at all. It is imperative in the managed care environment that we reduce costs to survive in the long term and be viable as a healthcare provider for this community.
Okay, great. Well, we're going to have to take a break right here.
Okay.
And we'll be back and finish this interesting discussion about healthcare and the hospital's future. Thank you for joining us for this portion of Visalia Business. We'll be back in just a moment.
What makes a strong business community? How can we all pull together to help create a stronger local economic structure? The Visalia Chamber of Commerce has been serving our community since 1898 and has since helped build and guide small and big business to help reach their goals. How can you get the competitive edge? Call the Visalia Chamber of Commerce. You'll be glad you joined.
What do parents say about Shriners Hospitals?
The Shriners saved Adam's life.
To me, Shriners were funny people who rode on motorcycles. But, I mean, they take care of people. They care so much for the kids. I've never seen people who, I mean, in my whole life, I've never seen people who give so much.
For information, call this toll-free number.
Timmy, come on, let's go. I'm in a hurry.
Timmy may not be old enough to drive yet, but he already knows that driving over the speed limit is no fun. Maybe he knows that driving over the speed limit can increase the amount of pollution in California's air, or that exceeding the speed limit reduces reaction time and braking distance. Take it from Timmy. He knows. Driving over the speed limit is just no fun. A message from Timmy and the California Office of Traffic Safety.
If you ever wanted to go behind the scenes in TV, let Continental Cablevision open the magic door. Become a volunteer for Channel 24 and you can learn all about camera, audio, and lighting. And you take part in producing the shows that air on Channel 24. Break the couch potato blues and take part in the behind-the-scenes action in the exciting world of television. Call 688-7593 extension 417 to find out more about Continental Cablevision's volunteer opportunities.
Welcome back to Visalia Business. We're here visiting with Carl Anderson, who is a board member of Kaweah Delta District Hospital, and Lindsay Mann, the Vice President of Planning and Professional Services for the hospital, talking about the acquisition, the recent acquisition of Visalia Community Hospital by the District Hospital. And when we took our break, we were just talking about perhaps how the hospital might be used in the future, what would the community see happen at Visalia Community Hospital, and when will this change take place?
Okay, when we, just before we broke, one of the big issues, are we going to close the doors? Are we going to close the place, close it down? And it just doesn't make any sense to do that. One of the reasons for purchasing the hospital was providing the flexibility in the use of our hospital facilities. We have a seriously land-constrained main hospital, and this provides us an opportunity to utilize another facility. It makes no sense to close it down. It just doesn't. It makes a lot of sense to use it as a health-related facility that adds value to the community. And the task force that we talked about before the break is doing just that. They will work with people from Visalia Community, people from the district hospital, and other interested parties that can add input into this and determine the best use for it. But in all, as far as sitting here and my thinking is, it just would make no sense to use it except for a healthcare facility, and that is our full intention.
And of course,
right at this time.
You know, I'm sure that that you're viewing it also as a cost savings by not duplicating services,
absolutely,
but
absolutely.
having you know, that be one service that's offered in addition to what's happening at Kaweah Delta.
There's a lot of combining of services that we can do and eliminate a lot of the fixed costs that are associated with it. Any businessman knows that the lower your fixed costs are in relation to your total cost, the more competitive you are. And that's what we need to do there. We see potentially some, as I mentioned earlier, some very significant reductions that we hope to make in the healthcare costs in the area, and I'm talking about in the order of magnitude of let's say 3 to 4 times what the property tax loss would be
Yes,
that's been an issue. That's been an issue. And so, well, now the county and city are going to lose this property tax base, and so that is and that's true, because being a district hospital, we don't pay tax.
That's right.
But if we're able to do what we think we're going to be able to do, we'll be able to repay that back 2, 3, 4 times in lower health costs. So now, which way is the community better off? And that's an argument that people carry on forever. But remember, the board of directors of the hospital, as far as the hospital district, that is what we are looking out for. We're trying to provide best health care at the lowest cost, and we saw a real chance to get a leg up on that with this purchase, and so that's what we did.
And of course, you can view the hospital as being, it is owned by the community itself, rather than being a private hospital. Right?
I would like to go on record saying that I did not pay you to say that, but that is...
Well, am I right?
That's right. It's their hospital. Okay. The board of directors works for... a lot of times I get the feeling that people think of the Quia Delta Hospital District as one of these Machiavellian creations that's out to gobble up and just control the world. No, it's their hospital. It's the people who live in the district and pay taxes. It's their district. We're serving at their request and trying to do the best job for them as we possibly can. It is not some secret organization trying to take over the city of Visalia.
And Diane, I think I'd like to interject here that there's a misconception that the tax base of our hospital's operation, of Quia Delta Hospital, is enormous, and that really we depend upon our tax base for ongoing operation. And I'd just like to have the record reflect that less than 0.2% of our annual revenue comes from our tax base. That literally would allow our hospital to stay open for just under 1.5 days of its operation on a 365-day calendar year. So the tax base, in terms of our allocation of tax resources, is extremely modest. And I just like that to be understood, because frequently in the papers and commentary, it's, well, what's happening with our tax base?
I see. One of the other concerns that has surfaced in the papers, people writing in and expressing some of their concerns, has been that Visalia Community Hospital had the reputation of offering a personal touch. And some people were concerned that perhaps a larger hospital would not offer that personal care, and they're afraid that that now that facility will lose that.
Let me just address that briefly. Just this morning I was on our intensive care unit visiting with a registered nurse by the name of Virginia, who described in detail how much she enjoyed caring for her patients on an individual basis, how she enjoyed the one-on-one care and affiliation that she maintained there. And I think the value of caring happens on a personal one-on-one level. And we certainly applaud the culture of personal caring that has been developed at Visalia Community Hospital and recognize it as one of its assets. And in fact, one of the things that we will seek to do is to take that, in business terms, intangible assets, in personal terms, that spirit of caring, and bring that into our organization and share the best of both cultures. Clearly, we are going to look at merging the very best attributes of both facilities. And I think Community Hospital has had an excellent reputation in that area. I would also indicate that there is not a day that goes by that we don't receive multiple phone calls and letters about the individualized personal care that's received by our staff as well. So I would suggest that it's misconstruction to suggest that one or the other facility have a more caring environment, but we're certainly going to seek to bring both areas up in terms of their ability to be personal and caring in the services they deliver.
Good. Well, for some folks that may not have tuned in at the very beginning of the program, we might want to, talk about the timeline a little bit here as to what's going to be happening with the hospital. And September 1st is when you actually take possession?
That's right. That's right. In fact, Health Trust, in their initial discussions with us, they wanted us to take over 2 weeks earlier than that. And we were the ones that forced all that because we wanted to try and ameliorate as many concerns as we could before we actually closed the negotiations and the deal. So we were the ones that made it that late. Even that sounds pretty pretty quick, and it is. That was their timetable. Now we have an opportunity to drive the timetable as far as the integration of that facility into the Kuya Delta system. And Lindsay, from an operating standpoint, I think could maybe discuss some of those details a lot better than I can.
Yes, and we'll begin September 1 to create the task force that Margaret Foley and Tesler will work with, and over at least a period of 6 months we'll begin transitioning. Our commitment is that the range of services that Visalia Community Hospital currently offers will be continued during that period of time. Operationally, how those are delivered might be altered in a number of ways that make a good deal of sense operationally, so it's not that we will not be making changes during that 6-month period of time. But I think one really key issue that has come up frequently is whether or not patients at Visalia Community Hospital or that have anticipated care being received at Visalia Community Hospital will still have access under their third-party contracts. Many times their insurance company will dictate which facility they should go to. It is our commitment to honor each and every contract that Visalia Community Hospital now has and to maintain the services that are currently at Visalia Community Hospital so that those patients and families expecting care at that facility will be able to receive that, at least during the time that we're studying what the options should be for final development of these services. Frankly, I should probably back up and say I don't think anything is final. In healthcare, there is enough dynamics that you're constantly working with moving targets as to what makes sense clinically first. And I think if I would express one value that I have seen our board and our hospital maintain consistently over time is first, anything we do must be qualitatively superior. We expect quality to be top-notch and first and foremost in our value set, and then that it be economically viable. We do have things that we will subsidize from time to time from a community benefit standpoint, but we will look very closely at quality and at cost effectiveness in our equations always, and I think that will guide our decision making over time.
Good. Well, I think Visalia has been very fortunate for a community of this size to have the kind of health care that exists here. It's something that people express a lot of gratitude for. You have about 2 minutes left. If there's anything else that you'd like to share with us before we close.
I'd like to clarify or add on to one point that was made earlier. We were talking about the patient care and the caring nature of it. Lindsay was a little bit reticent to discuss this, but part of the evaluation of all the department heads at the hospital district has to do with patient satisfaction. We monitor that very, very closely. And if something crops up, we move on it very, very quickly. I mean, that's an integral part of the operations and their performance. And so, from what I've seen from those surveys in the past, I don't think people are going to be disappointed by coming to, by having the district take over the hospital.
Good. Well, we will be excited to see what the future holds for healthcare here in Visalia. And thank you very much for sharing with us about the plans for the hospital. And I'm sure it answered a lot of questions out there.
Thanks for having me.
Thank you for the opportunity.
You bet.
And thank you for joining us for Visalia Business.
Shine, a shine, a shine. residents